Hey, this is Adam Almaguer. I'm an orthopedic surgeon and total joint replacement specialist at UNC Cary Orthopaedics. My hope is that this video and the associated total joint packet provided will be a valuable resource to you as you navigate through the process leading up to and recovering from surgery. I encourage you to take notes, write down as many questions as they come up so that they can be answered before the surgery. To begin, on the packet, there's a QR code on the first page. There's also my website URL below this. This has additional resources under the Established Patients tab, and there's a password provided, as that part of the website is password protected. Before I move on to the packet, I would like to discuss the option of a handicap placard application. This is completely optional, but let my team know if you'd like to pursue this. We will provide you with a signed application. All you need to do is fill out the demographic information, then either mail it to the DMV or bring it to the DMV in person. It's valid for 6 months after surgery. Additionally, it's helpful to discuss the durable medical equipment that can help with your recovery. First is a rolling walker, which will be provided by our office and is covered by insurance. All patients use a walker immediately following surgery to help with balance. The remaining of the items are not covered by insurance and would need to be purchased out of pocket. The first item I recommend is a 3-in-1 commode. This functions as a bedside commode, an elevated toilet seat, and a shower chair. The most beneficial function after surgery is the elevated toilet seat, which allows you to more easily sit at a higher position than a standard toilet seat. Alternatively, you could purchase an elevated toilet seat, and I would recommend choosing one with handles. Either of these items can be purchased online at Amazon or in person in stores like Walmart, Target, CVS, etc. Our office has also put together a hip kit, which includes all of the other necessary items that will help with your recovery after surgery. If you'd like to receive a hip kit, let our team know at your preoperative visit and we can provide that to you. For those of you having surgery at UNC Rex Holly Springs Hospital, it would be helpful to review an exterior map of the facility to see where parking is, as well as the main entrance of the hospital. There's also an interior map that you can review. The lowercase I to the left of the main entrance is the information desk. You'll check in here the day of your PAC test, also known as your anesthesia checkup. They'll check you in, get you to registration prior to sending you up to the 4th floor where your anesthesia appointment will take place. It's also important to point out that the cafeteria is on level 2. The hospital will also provide resources, including their own total joint class video. It's roughly a 20-minute presentation with more general information about the hospital and surgical process. Participation in this class is not required, but it is important to know that they're available if you're interested in receiving some additional information. Instructions to access this presentation will be provided to you at your hospital anesthesia visit. For those of you having surgery at Blue Ridge Surgery Center, you'll receive an email to create your Medical One passport. This is important to complete for your medical history, screening, and anesthesia clearance. Now, moving on to the surgery manual, we have provided information on who and when to call if you have questions. Alternatively, you can send a MyChart message to me and someone from my team will get back with you with a response. Listed are a few important reasons that you should call the office. Low-grade fevers are not uncommon following surgery, but if your temperature exceeds 101 degrees, you should first take a dose of Tylenol, allowing 30 minutes to an hour for it to fully take effect. And if your fever remains elevated above 101, this would warrant a call to the office. In regards to swelling, this is also common following hip or knee replacement. Acute worsening of swelling and severe pain in the calf could be a sign of a blood clot. If applying ice and elevating the leg doesn't seem to help, this would be another good reason to call our office. Next is information for Hibiclens, which is an antimicrobial soap you should use once a day for 5 days leading up to surgery. This will help decrease the amount of bacteria on your skin going into the surgery, and Hibiclens can be purchased over the counter. It's typically found by other first aid items. When using, you should apply to a washcloth and then beginning at your collarbone, cover your entire body down to your feet and toes. Avoid applying to your genital area where typical soap can be used. Once applied, allow it to sit for 3 minutes, then wash off like you normally would. After showering, do not apply any lotions, oils, or creams to your skin. You may notice that your skin will start to dry out, and this is not unexpected. It is okay to apply lotion to your face and deodorant as you typically would. Preventing MRSA is also important in decreasing your risk for infection. MRSA is a staph bacteria that many people carry on their bodies naturally. Applying a mupirocin antibiotic ointment to your nostrils twice a day for the 5 days leading up to surgery will help eradicate this bacteria and decrease the risk for infection. You should apply a small piece size of ointment to a Q-tip, then insert in your nostril and swirl around. The Q-tip can then be removed and repeated on the other side. After applying to both nostrils, you'll pinch your nostrils and gently massage to help distribute the medication throughout your nose. Again, this will be done twice a day, morning and evening, for the 5 days leading up to surgery. Next is information regarding the preoperative anesthesia appointment at the hospital. They will want to know your daily medications, so I recommend bringing these to the appointment. They will let you know which medications to take the morning of surgery and which medications not to take. They may also draw some blood for lab work, but these labs are not fasting, so you can eat and drink as you normally would. This appointment takes about an hour to an hour and a half to complete. I've also provided information regarding specific medications to stop prior to surgery. These include hormone replacement therapy, NSAIDs, blood thinners, vitamins, and herbal supplements. Stopping these medications as instructed is important, as they can thin your blood and increase the risk of bleeding during surgery. If you receive different instructions from your primary care provider or cardiologist, it will be noted in your medical clearance and we will follow their recommendations. Other considerations around surgery include dental procedures, which also includes teeth cleanings. I recommend rescheduling any dental appointments for 3 months prior to surgery and 3 months after surgery. Next is what to expect the day of surgery. I've provided a list of items to leave at home, as well as a reminder of things you want to bring the day of surgery. I recommend wearing loose-fitting clothes for ease of changing, and you should be accompanied by a family or friend the morning of surgery. Plan on arriving 3 hours prior to the scheduled surgical time, and your surgery time as well as arrival times will be told to you at your preoperative visit. After checking in, you will be brought to the preoperative area where you'll be changed. Your nurse will start an IV, and you'll meet with the anesthesiologist. I will also meet with you to confirm our plan for surgery and answer any questions. The entire surgical process will take about 2 hours, and I will speak with your family or friends in the waiting area as soon as the operation is complete. Prior to leaving recovery, an X-ray will be taken confirming that the components are well positioned and without complication. If you're planning to stay overnight, you'll then be transported to your private room where you'll begin working with physical therapy the day of surgery. For those of you discharging same day, you'll then be moved to phase 2 of the recovery, where physical therapy and occupational therapy will meet with you and ensure that you meet criteria to safely discharge home. This includes standing, getting in and out of a chair, and walking in the hallway. They will also cover any precautions you should consider. Your nurse will ensure that your pain remains well controlled and will provide you with snacks to ensure you're able to eat and drink safely. Lastly, you'll need to urinate prior to discharging home. Next is a list of medications that will be prescribed to you at your preoperative visit. These medications are to be taken after surgery, but you should pick them up well ahead of surgery so that they can be at home available for you to use once you get home from the hospital. If there are any medications such as NSAIDs that you've been instructed not to take, or if you have any allergies to the medications listed, please let me know at the preoperative visit. For pain control, I recommend beginning by taking meloxicam, which is an NSAID, once a day, in addition to Tylenol, 1,000 milligrams 3 times a day. Do this around the clock on a scheduled basis for the first 2 weeks after surgery, but there are other medications to consider for pain, including tramadol for moderate pain and oxycodone for severe pain. These can be taken every 4 hours as needed, and the goal for pain control is for these medicines not to take away all of your pain, but rather to reduce your pain to a level that's tolerable. One strategy to consider is alternating the tramadol and oxycodone every 2 hours. If you continue to have uncontrolled pain with this schedule, you can take 2 tablets of the medications instead of 1. Lastly, a muscle relaxant can be used to help with pain from muscle spasms. Refills of these medications will be provided if needed, but please give us a 1 to 2 day heads up to ensure the refill is sent before you run out of the medication. Because narcotics can cause constipation, it is encouraged to begin taking the Colace stool softener twice a day starting the day after surgery. If your constipation is not resolved with the Colace, you should next use Miralax, which is available over the counter. This is a tasteless white powder, can be added to drinking water and drank. Dulcolax is a tablet that's also available over the counter and can be considered. Please call our office if you have not had a bowel movement by 4 days after surgery. We've also provided a packet as an example of what hip and knee replacement components look like. For hip replacements, there's a metal femoral stem with a ceramic head, a special plastic liner, and metal acetabular component. For knee replacements, there's a metal femoral component, metal tibial component with a special plastic spacer between, and then a special plastic button on the kneecap. Next is the physical therapy aspect of recovery. Physical therapy will work with you at the hospital before you discharge home. We will then have home health physical therapy come to your home to work with you 3 times a week for the first 2 weeks after surgery. At your 2-week postoperative visit, I'll provide a referral to the outpatient physical therapy office. This can be completed at one of our offices in Cary, Holly Springs, or Morrisville, or can be done at an outside facility closer to your home at your convenience. With hip replacements, the therapist will educate you on hip precautions and show you what positions to avoid for the first 6 weeks following surgery to lower the risk of dislocation. For knee replacements, there are no precautions. Instead, there is an emphasis on knee range of motion to ensure that stiffness doesn't develop, which can be difficult to treat. Range of motion tables have been provided, which can be used in tracking your postoperative recovery. Next, what to expect after surgery. It is important to understand that everyone has bruising and swelling after surgery, and this can affect the entire leg down to the toes. This does not mean anything is wrong, but simply your body's response to the trauma of having such a big operation. Swelling can last through the first 2 to 3 months following surgery. Standing up, short walks in the home every hour or so is encouraged and can help reduce swelling, as well as keep the blood flowing to reduce the risk for blood clots. When you're not up and walking, ankle pumps can also be done. While every patient recovers at different speeds, you can expect to achieve approximately 80% recovery at the 6 to 8 week mark after surgery, with the remainder of recovery taking up to a year. In regards to your dressing, this should be left in place until you see me in the office at your 2-week visit. Patients having knee replacement can unwrap the ACE bandage from their leg 2 days after surgery. You can start showering 4 days after surgery, but should either place press and seal over your hip dressing or wrap your knee dressing with saran wrap to keep the surgical dressing dry. Do not submerge your incision under water or apply creams or lotions to the site for 4 weeks after surgery. When it comes to driving, you are required to be off of narcotic medications before returning to driving. Studies have shown that your reaction time is delayed for 4 weeks after surgery, so if you begin driving during that time period, be sure to drive more slowly, stay farther away from other vehicles to ensure your safety. Lastly is infection prevention, which is a major concern following joint replacement. The list provides details of procedures that require a dose of antibiotics prior to having completed. The antibiotic is a single dose that should be taken approximately 60 minutes prior to the procedure. Notify my office of any upcoming procedures and we'll be sure to prescribe the antibiotic in time. It is recommended that this be done for the rest of your life. I hope this video and the provided packet is helpful in preparation for your upcoming hip or knee replacement. As always, I encourage you, write down questions and be sure they're answered prior to surgery. I look forward to you getting on the road to recovery and back to the activities you enjoy. I'll see you soon.